As local school districts and Governor DeSantis battle it out, the governor has repeatedly cited statistics from the American Academy of Pediatrics to make his case. He claims those numbers show on a percentage basis the same proportion of young people are being infected with COVID as during previous waves of the pandemic. 10 Tampa Bay's Eric Glasser is diving deeper into those claims and found out why critics say it's just not true.
We've not seen any major changes.
At several news conferences over the past 2 weeks, Governor DeSantis has cited statistics from the American Academy of Pediatrics, part of the basis for his executive order banning in-school mask mandates.
The American Academy of Pediatrics recently acknowledged that they're seeing that there's no evidence that they've seen that Delta is more impactful on kids.
The problem, say those watching children's COVID cases climb, is that the AAP report suggests the opposite. It found as of August 26, child cases have increased five-fold in the past month, rising from about 38,000 cases in the week ending July 22nd to nearly 204,000 cases the following week.
I think the state of Florida really deserves better leadership.
Today, U.S. Representative Kathy Castor lashed out at DeSantis and the Florida Board of Education.
And I would urge Governor DeSantis to stop downplaying the important public health protocols.
The governor contends while the total number of COVID cases in children is higher, percentages have remained steady.
The data is pretty clear that we have not seen any difference in terms of the proportion, in terms of hospitalizations or mortality.
But the American Academy of Pediatrics report again shows the proportion has risen from 14.8% since the pandemic started to 22.4% in the week ending August 26th, a 51% increase.
And I think there is evidence, at least in the past 2 weeks, that children are making up a much higher proportion of all cases that are emerging in Florida.
We do have a lot of children who are being admitted to the hospital.
The AAP report does conclude that severe illness due to COVID-19 is still uncommon in children. Governor DeSantis has repeatedly said it should be up to parents to decide whether their kids wear a mask to school, citing Florida's Parental Bill of Rights. But if the governor and the State Board of Education are going to cite statistics to enforce that policy, critics say the numbers should be current and accurate.